The UK becomes the first country in the world to approve Pfizer's COVID-19 vaccine for emergency use. But as more vaccines are approved, more countries are scrambling to get their own supply. Fox News correspondent Greg Palcott has the latest from London.
We still have at least a week before the FDA gives approval to the Pfizer coronavirus vaccine in the U.S. But it's a different story here in the U.K. Regulators announcing Wednesday they've approved the vaccine for widespread emergency use, and the first doses should be distributed by early next week.
We expect to deliver in the coming days, somewhere in the region of about 800,000 doses, and then scale up from there.
The approval makes Great Britain the first country to start a mass inoculation program with Pfizer's vaccine. The initial shipments will go mostly to nursing homes, followed by doctors and nurses from the National Health Service. And they'll be free for every British citizen.
Rolling out the vaccine, free at the point of delivery, according to clinical need, not ability to pay, is in the finest tradition of our National Health Service.
And other countries could be looking to follow the UK. Just hours after the announcement here, Russian President Vladimir Putin ordered officials to start mass vaccinations next week. But global health officials are warning, with rich governments rushing to buy in bulk, there may not be enough vaccines to fully contain the virus in the developing world.
If we continue to ignore the realities of what emerging and dangerous pathogens can do to our civilization, then we are likely to experience the same or worse again, and within our lifetimes.
Pfizer says they've signed contracts for some 600 million doses of their vaccine around the world by the end of next year, and maybe many more to come. In London, Greg Palcott, Fox News.
The CDC has shortened the recommended quarantine period for those exposed to COVID-19. The agency continues to recommend that people quarantine for 2 weeks after exposure, but have identified 2 acceptable alternative periods. After analyzing research and modeling data, the CDC says individuals can end quarantine after 10 days without a test and no symptoms. The second option is that quarantine can be stopped after 7 days with a test and no symptoms. The agency encourages everyone to continue monitoring for symptoms for 14 days, especially if quarantine has ended early.